Exactly. Talking about issues. It's summertime. You know what that could mean? Lyme disease. We get an email from James in Carmel, New York. He writes, I am 61 years old and have had Lyme disease for 22 years. My mood and temperament and ability to handle stress is horrific. What does this disease do to the brain? He says, I became ADHD and OCD, and it basically destroyed my career. Dr. Samadi, this can be really serious when you get Lyme disease.
Yeah, it's not a simple answer to this question, and you really have to dig in and find out and ask more questions, and whether there are any other psychological issues in the past or not, and get to know this person. But based on the email that we have, I can tell you that Lyme disease is always being misdiagnosed because it's like a gamut of things. The first thing is the actual rash that you find. It's a very specific bullseye rash with a red circular one and a white halo in the middle. You need to recognize that. A few days after, you may have flu symptoms. Everybody has flu symptoms, and that's one of the reasons why it's difficult to find out what you have. Then goes to your joints, cardiac issues. The thing about Lyme disease, Eric and Jamie, is that it can go through the blood-brain barrier. It can go to our brain, cause a lot of inflammation. And that can be treated with antibiotics, but we're talking about 22 years of this problem. This is chronic. And there are studies that shows Lyme disease can affect your brain to the point of increasing anxiety, OCD, attention deficit, ruin marriages, and work. My advice to this person is to really continue the fight, continue the battle. There are some studies that shows that IV antibiotics of ceftriaxone, ceftriaxone is a very aggressive antibiotics that we give for about a month or more to really dig into the deep tissues of the brain, and I hope that helps. But obviously, you have to be careful with these emails because you have to get to know your patient.
Dr. Siegel, the big question is Lyme disease. How do you prevent it? How do you spot it? And that's a tiny little thing that you can
You're talking about a tick bite.
Yeah.
Right. I see a lot of Lyme disease in my office and a lot of people that think they have Lyme disease.
Yeah.
And that rash David is talking about is there only about 60-70% of the time, which is a lot. But if you don't have that rash, you still can have Lyme disease. And then the number one symptom I see is fatigue. And you might have depression, and you might have problems thinking, and you might get some joint aches. If I treat it early enough, Eric, it's gone. But where this email comes from is 22 years later, he's still having symptoms. Unfortunately, a lot of people think they have chronic Lyme disease and they don't actually have it, but it gets very hard to tell because the blood test I do for Lyme disease doesn't prove it one way or the other. But if you start to have problems, severe neurological problems, you can have paranoia from this, you can have personality changes from this. It's possible that he does have it. Now, we don't know yet, and this is where the research is going. Is it from the spirochete, the bacteria, or is it from some inflammation or your body's immune system attacking back? We don't know. I like David's suggestion a lot. For a patient that we think has chronic Lyme, ceftriaxone antibiotic.
All right, if you're out there in the woods, look at yourself. Exactly.
All right.
Cover yourself.
Thank you so much. That is a big issue. Thanks for the email as well. Meanwhile, our country lost her way too